In just 4 short months, Susie Silvestri went from being convinced that she was going to be healed of her ALS at a Canadian health center to being stuck in a small-town U.S. hospital, all alone, unable to eat and fighting for her life. Her journey began last year when she came across this man, Goodenowe, a scientist who tells people
not to be flippant, but stopping the progression of ALS actually isn't that hard.
Susie texted her brother, "Brace yourself. He has a 100% success rate with all his ALS patients."
Well, when you've got a death sentence, you're going to try whatever you can.
So last summer, she put her home up for sale so she could afford the cost of Goodenow's 3-month live-in program, which was $84,000 US. She hired a medically equipped plane and flew from her North Carolina home to Goodenowe's Moose Jaw, Saskatchewan Health Center.
He was hoping to be cured. Sort of, "Susan, I think you're crazy, but best of luck for this trip."
But instead of getting better, she progressively got worse. Her brother, Charles, watched helplessly from his home in the U.S.
He couldn't swallow, couldn't eat. That's what it does. It takes away your muscles.
Her hospital records say she was in end-stage ALS, defined as the final phase of the disease. She begged doctors at the Moose Jaw Hospital for a feeding tube, but they said no, because her American insurance would not pay the bill. So Susie decided to travel 4 hours south to a small town in Montana where her insurance company agreed to cover the cost. Susie had to make all the arrangements by herself, and she had to foot the bill for her travel. A former Goodenowe worker was frustrated that the company didn't step up and help her.
To see little Susie with her, laptop trying to figure this stuff out by herself, I think more care should put into that.
Susie's siblings say they were trying to bring her home as she kept getting worse. Her last text in the family group chat was this photo on Christmas Eve last year. Susie died on Boxing Day, all alone in that Montana hospital. Earlier this year, a CBC investigation examined Goodenowe and his restorative health center. Some of his former clients told CBC they did not get better on his supplements as promised. But he cast doubt on that.
And we do document every single person that comes through our center. Okay? They leave that center better than they came in. Okay? And that's just simply a fact.
Goodenowe is suing CBC for those stories, alleging that they are defamatory. Through his lawyer, he told CBC he had no comment about Susie's story, writing, quote, "We don't talk to people we are in active litigation against."
This is the new Wild West of laissez-faire health delivery and health service.
Dan Florizone used to run Saskatchewan's Ministry of Health. He says it's shocking that Goodenow's center is completely unregulated by the provincial government, given the condition of the people it serves and the high level of care it provides. It says this story should be a wake-up call.
So buyer beware is not the principle by which we want to operate a health system.
Jeff Leo, CBC News, Regina.